It strikes me here you are in this fight, in the battle against coronavirus. If you wanted to see hospitalization stats from the CDC today, you would have found their website empty of them. Talk about the public and what we're supposed to get during a public health crisis.
Good evening, Brian. You know, the public needs access to transparent information. I love access to that information, but you know who needs it more than anything else? Our decision makers, our elected leaders. What are they looking at? What type of information do the elected officials have if they don't have access to publicly available CDC information? I don't know, because right now what we do know is in a place like Florida, the Florida Secretary of Health is actively engaging in data manipulation. They're not talking about ICU beds available. They're talking about acuity of the patient presentation, severe or acute. Who knows what that means when it comes to whether ICU beds are available? Brian, let me take a step back and also talk about just the ethics of what's happening. You mentioned Governor Kemp in Georgia. You know, right now we've talked about what's been politicized, what's not, what's amoral, what's not. This is ethical, Brian. We're talking about withholding access to interventions and solutions that could save lives. He has crossed a line here about what is and is not ethical in the space of saving lives. Banning the mandating of masks in a dense urban population like Atlanta is crossing a line of ethics. And we need to reevaluate his fitness for office. This is unacceptable. Governor DeWine in Ohio, what he's doing, unacceptable. I can go on.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.